According to the National Library of Health, weight needs to be monitored. Um, weight needs to be monitored in patients with cannabinoid hyperemesis system because in some severe cases, feeding tubes are considered internal feeding tubes. Today, I'll be informing you on cannabinoid hyperemesis syndrome and about the dangers that come with excessive cannabis use. A friend of mine was diagnosed a couple months ago, and it blew our minds, and I decided to look into it more. This is every this is something everyone should care about, even if cannabis isn't in your choice of interest. It's still good medical knowledge to pass on to, just pass along. I will discuss what CHS is, cannabinoid hyperemesis syndrome, and I refer to it as CHS. Um, how does it come about? The symptoms of CHS and the symptoms and effects of CHS and the treatments for CHS. According to the National Library of Medicine, Dr. Jonathan A. Galley, Ronald Frank, and Friedenberg state in their abstract that with the increasing rates of cannabis use, with cannabis abuse, there has been the recognition of new clinical conditions known as cannabinoid hyperemesis syndrome. Cannabinoid hyperemesis syndrome is characterized is I'm sorry, yeah, is characterized by chronic cannabis use, meaning those that partake in cannabis use need to be well aware of this danger due to the undiagnosed rates being so high. According to the National Library of Medicine, it is likely that the disease is underrecognized and underdiagnosed. To promote wider recognition and further understanding of this condition, we conducted a case series to the largest. I'm sorry. We conducted a case series to the largest to date of patients diagnosed with CHS at our institution. The results from this case study reported one thing found common was um, long-term use of marijuana before the symptoms started, a history of recurrent vomiting, and the third is the absence of a major illness that could explain their symptoms. Sorry. Now that we've talked about this, now that we've talked about what cannabinoid hyperemesis is and how you get it, let's talk about the symptoms and effects of cannabinoid hyperemesis syndrome. A study was conducted from June 2005 to 2011, and it was discovered that 66 of the 98 participants that experienced CHS were male, while 32 were female, and both were under the ages of 30. According to the National Library of Medicine and Health, all patients had symptoms of nausea and vomiting. In 71% of the patients, the symptoms were present in the morning, while only 16, which is 21%, had symptoms associated with meals. 84 patients, which was 86%, had abdominal pains with nausea and vomiting. There are three different phases of cannabinoid hyperemesis syndrome. The initial phase is called the prodromal phase. According to Cedars-Sinai, a nonprofit hospital in Los Angeles, they state, during this phase, the main symptoms are often early morning nausea and belly pain. Some people also develop the fear of vomiting, and most people keep eating normal patterns during this time. Some people use more marijuana because they think that it will stop the nausea. This phase goes on for months or up to years. My friend that was diagnosed with CHS told me she experienced horrible nausea in the mornings and vomiting spit in her initial phase. Phase two is called the hyperemetic phase. Hyperemetic phase, which the symptoms worsen. Um, Sears Sinai states, during this phase, vomiting is often intense and overwhelming. Many people take a lot of hot showers during the day. They find that doing so eases their nausea. That may that may be because of how the hot temperature affects a part of the brain, which is called hypothalamus. This part of the brain affects both temperature regulation and vomiting. People often seek medical help during this first phase. My friend tells me, as time went on, she was throwing up her food violently, and the hot showers happened in her initial phase rather than her second phase. And she told me how she would, take those hot showers up to 10 times a day, at least 10 times a day. She explained to me how it was the only thing that made her feel better, and she told me how she just began to not eat and drink, which just made things worse. And this all, she went through phase one and two all in just a 2 month period. So before it said it'll take up to months to years, she went through phase one and two in just 2 months. Now that we've talked about the symptoms and effects of cannabinoid hyperemesis syndrome, let's talk about the different treatment options. According to the National Library of Medicine, they state lack of awareness of the disease may lead to invasive and costly diagnostic tests, as well as patient and physician frustration. Doctors often have a laborious time diagnosing CHS. Here's a statement from my friend. I'm just going to literally read it word for word because this is something I literally I can't paraphrase. She states, when I went to the hospital, they didn't know what was wrong. I wasn't pregnant. All of my CT scans and stuff came back normal. I was just malnourished, and really because I let this go on for a month and didn't tell anyone. So because they didn't know what was wrong, they tried over 10 meds. And nothing worked. I was still in pain and throwing up. I didn't poop or anything because I wasn't eating, and they tried this one medicine called Ativan. That usually only works on people with cannabinoid hyperemesis syndrome. So they ruled out everything else. Technically, they can't specifically diagnose it. I don't know why, if it has to do with it being illegal or what. But anyway, after a while of throwing up acid, I started seeing blood in it. So they were giving me these nutrients that were a replacement for food. But I had to get a feeding tube placed in my arm. Because during the regular feeding tube procedure, I threw the tube up. There wasn't really a cure, but they found certain things to help me cope with my pain. After I was out of the throwing up and stuff, they gave me medicine to help with my appetite because I wasn't eating for so long that I wasn't just hungry, and then I slowly started back eating and drinking. There is no exact solution to curing cannabinoid hyperemesis syndrome, but it usually involves the need for nutrients, fluids, finding the right meds, and getting back into your old habits. If you experience or even think you're experiencing phase one, seek medical attention as soon as possible so you can find your cure and not have to go through what my friend went through. Today, the purpose of this speech is to create awareness of the dangers that can occur from prolonged cannabis use. In conclusion, if you are or you know someone who partakes in cannabis chronically, go to or suggest going to your doctor and get checked so you can avoid the expenses and frustration when cannabinoid hyperemesis syndrome is taken too far without treatment. Thank you for listening to my speech.